Thank you very much to AIOS for giving this sacrosanct space to Yossi for this very pertinent topic and the session of maximizing the residency. So I want to begin by saying that all residents before joining, they focus on the cutting aspect. Yes, the term they use is cutting and how much surgery in this. So at the beginning, let me just please emphasize this point that it is the quality of teaching and learning of the surgery that matters much more than the uh, quantity, just the numbers first. Secondly, if you see, the OT is going to be a very, very sacred space for you. It is going to be where you are going to learn to transform from an MBBS graduate into an ophthalmic surgeon. It's not an ophthalmic, yes, institutes do give the MD, but ultimately you have to remember that we are becoming masters of surgery in some way. So it's a dynamic learning environment, and what you learned in theory has to come into practice over there. And how do you know what to do for that? So it's the preparation before the OT that will help you optimize your learning experience inside the operation theater, and it will ultimately help you grow as a surgeon when you will also reflect on it and try to improve upon yourself in the hours after the OT, and then come back in a renewed manner in the next operation theater duty or turn that you have. So that was what will help you transform into a skilled surgeon. So your preparation trifecta includes the patient specifics, the surgical plan, and the instruments and the steps of the surgery. So please be involved with your mentors when they are preparing the patient for the surgery, whatever they are doing for the surgery, how they are explaining to the patient. Then remember, eyes won't see what the mind doesn't know. So when you know much about the surgery and you have read up about the instruments, you will assist better and hence you will learn better. And knowing about the consent points are also very, very important. How do you understand equipment? How do you familiarize yourself? Well, years ago when there was no internet, people were doing it. So I'm sure now that everything is at the tip of a finger tap away, you can definitely learn. There are so many online resources. I would recommend specifically certain books, and ESCRS I learned benefited me a lot in my preparation for my OTs. And now you can see so many channels are available that will help you refine your skills. But something which is very overlooked is the mental preparation. Please don't be rushed before OT. On the day of the OT, if possible, pray, meditate, whatever sets you in a calm state of mind. Because if you will be in a very rushed state of mind, then you will not be able to absorb what is being taught or what is happening in the OT. So it's up to you what you feel better doing, whether it's meditation, it's calm, it's journaling. For me, journaling was a very, very good way of preparing myself mentally for things. Coming to what you're doing in the OT. So if you are mentally elsewhere and physically present in the OT, what will be happening in the fast surgery? The Rexus is running out. You won't be even noticing it when your mentor is operating and you are merely assisting. So you are not merely assisting. You're not putting visco on the cornea. You're actually learning something. This is me operating under the guidance of my mentor, Professor Pankaj Sharma, sir. So I think he taught me how to take the ownership of my learning. And I kept asking questions. And because he would answer those questions, he would not shoot them down. And when I did not get a chance to operate with that good surgeons, I should say, every point of time you cannot be with the same mentor in an OT. He taught me that even those opportunities are very golden because you will ultimately be learning what not to do. And when you are observing and assisting, you have to understand that that moment is crucial to becoming a better surgeon yourself. Seek out guidance. My PG training did not have exposure to refractive surgery. So I went and did a training under Rupal Shah ma'am later after my post-graduation in my senior residency. I think that was very vital for me. And there are other mentors also in other learning opportunities. There are many other courses that you can do. I did for glaucoma as well. So I think all that is your way of seeking out and improving yourself. Look for opportunities. Don't crib about what is negative in your training. Now, asking the right questions. When you are operating, if you will time your questions and you will ask for feedback during your own surgery, you will improve tremendously. I used to maintain a OT diary for myself. It was very, very useful. This is not a photo of my OT diary because it is not very pretty. I used to jot down immediately in the OT with a pen. And that used to help me a lot, because many times I see I've taught something to a resident now, and they come and operate with me again 2 weeks later. They have forgotten what I taught to them totally. They don't even remember like how to hold that forceps, and they look at you as if you're speaking in German. So that is something that should not be there. If you will remember what you have written and revise it before the next OT. So all this will help you into going from a simple assistant to a person who is doing steps slowly, and then from the steps the entire surgery perhaps. Also, many residents, when you ask them, did you wash today, what did you do, how many surgeries, what all, they'll say, we got only one case, we got only one step, we did the whole case, but the IOL was put by our mentor, there was a rent. You got a surgery, you got a live human patient. People are traveling all the way from US, Europe to learn how to operate in India. You are getting that and you are not thankful for it. So be thankful for every opportunity. If you could not do something and your mentor did it for you in that surgery, that should be the moment to understand what can I do better so that I am able to complete it myself the next time. The complications are widely documented. You can document your complications. You can read up those complications. You can online see the videos that are there, and that will all help you for the next time. All these complications that are happening, their decision making is very quick. So if as a first year or second year resident, you're merely assisting and thinking that I'm just putting saline on the cornea, what am I doing? No, you're observing, you have a chance to see how these complications are being managed. Then if you have the facility, please record the videos and review them. There are so many excellent surgeons like Dr. Karan Bhatia. The AIOS proceedings are also there. YouTube is there. So many other surgeons are there who are putting up their videos. You can learn from them. You can be a Eklavya and see what is being taught. Seek feedback. The mentorship will guide you and you will grow. I see Oscars, some centers are following, some are not following, but even if they are following, you will improve. If they are not, then also there is, you can yourself document your points of where you are fumbling perhaps. And the current method is that people are teaching hands-on and there is direct supervision. All this has been documented widely via research, and what this tells us that your complications are going to decrease day by day. Wet lab training is available to a lot of people, and some people have simulation based practice available as well. If you have simulators, you will improve some things. Most importantly, you will improve your dexterity. And if you don't have access to it, that is also okay. India is a diverse country where a lot of resources are lacking at various places. So because of the cost factor, it has not yet come everywhere. And the effectiveness is also right now at being questioned whether it is for mass review in India or not. So ultimately, coming back to whatever resources that you have, once your OT is done, please try to upgrade yourself and think about what went wrong, note it down and improve before the next OT. You have to practice and you have to introspect. That is the most important. And be patient with yourself. It's a process of continuous learning. So for me personally, I think a very good example was when I was in my school, my father had gone to learn phacoemulsification. He had learned ICC in his PG days, and that taught me that one has to spend time sharpening one's axe. So till date, he is improving himself, and I'm thankful to him for teaching me that same thing. I hope I keep learning and keep on improving myself and teach and pass on that same message to others. Thanking you all for this excellent topic also. Thank you.
Thank you, Dr. Sonal. That was very well covered, maximizing learning in OT, right from how one should be careful as an assistant. And as you mentioned, that learning happens at each and every step, journaling, documentation, being attentive in the OT, also learning from complications. I think that was really well covered, and all the residents should I think maintaining logbook is something which is a very healthy and a good practice. Also, what I feel is that, in fact, I learned this from Sonal only. She would tell me that before every OT, it's a good idea to watch a video of a surgery. So that's how I imbibe this. So before my every OT day, it was like a ritual. You have to, like some people have this ritual of praying. I could not enter my OT without watching one SICS and one phaco video. So that would work for me. Any comments from the other panelists?
Excellent presentation, Dr. Sonal, and you have actually covered all the nuances which is required. One thing I could actually add to the thing is like you can actually watch your immediate seniors, because those are the ones they tend to, like they are in that, you are almost in the same boat, so you can actually pick up those things which you should do, or which you should not. And if your mentors are there, then nothing like it, but immediate seniors are also the ones which would actually help you to take the mile. Yeah.
Excellent presentation, Sonal, and so true. We have to learn so much. The tissue handling, instrument handling, all these are, finer nuances that we miss out. So while we are standing there, I think I wish I could go back and relearn many things that my mentors used to do. But maintaining the logbook is excellent, and always reading up what you did wrong is always, I think, even we used to have during our fellowship days, and that time it felt very tedious. But I think looking back now, it was truly helpful. Thank you so much. Thank you.
Also, very important point of that thankfulness. So we get into this game of, as she mentioned, that we got only one step, two step, but whatever step you're getting, try to master that and perfect that. And you should be thankful that you have somebody, you're getting a case and somebody's there to teach you.